think the Vscan Air is a fantastic choice for GPs looking to introduce point-of-care ultrasound into their practice. It is a light, portable, easy-to-use wireless device that connects to your phone or a tablet in your GP practice, and the image quality is fantastic. For a GP just starting out, that is exactly what you want from a device. The ultrasound gives you a lot more diagnostic capability than the stethoscope itself. I don't think there has been any other innovation for diagnostic capability that matches ultrasound or handheld ultrasound. So I think it's a huge step forward for GPs and their ability to make diagnoses in their practice. The Vscan Air is a very cost-effective way of being able to introduce point-of-care ultrasound into your practice. Now, the Vscan Air has a curvilinear or curved side and a straight or linear side. So it has two probes built into one device, which is a fantastic innovation, a step forward. The pictures that we get are really high quality, and also the images can be taken off and put into an archiving device. I know that the Vscan Air helps to improve the patient journey. I have many examples where I have scanned a person after the clinical examination and history, and the information gathered from the scanning has changed the patient's direction. So they've either avoided A&E, so they could go home safely, or it has expedited their care. For example, I've called the hospital and I've told them that actually their problem is more serious than the clinical examination would suggest, and thus they've actually been seen quicker. So I think it speeds up patient care. The Vscan Air is a very effective device at picking up problems, clinical pathology in the body, and it will also pick up the needle as you guide it into the problem, where you can inject medicine to help relieve the pain. Portability for GPs is essential if we're going to home visits, if you work out of hours at the weekend or in an ambulance, then it is good to have the device on your person. And naturally it's got to be portable, and the Vscan Air without the wires and the small charging port, it takes up no more space than my stethoscope and my thermometer. The software that comes along with the Vscan Air that you use on your phone, there are lots of presets that you can use. And within those presets, there's the option of additional functional capabilities. For example, I may use M mode when I'm scanning the lung or the heart, and I may use Doppler when I'm scanning soft tissue lumps and bumps to look at flow through little structures. I have used Caption AI during my clinical consultations. Now, this is inbuilt artificial intelligence, which I can use to look at the function of the heart, and it can give me lots of clinical information about how well the heart is functioning. So the device will actually teach you where to put the device and how to angle it and how to rotate and how to move so that you've got the best pictures possible. So you've effectively got a teacher built into the device. As with any new skill, it requires good training and commitment to learning. However, when you do get to a certain point in your understanding, it is easier to learn new ways of scanning and new methods of scanning. It also then can work out the ejection fraction, so the overall function of the heart, for you without having to make lots of complex, timely measurements, which is fantastic for GPs looking for an answer in a short period of time. I've been a huge advocate since 2019 of GPs using ultrasound in primary care. I think it is the biggest step forward in innovation and diagnostic capability that a GP has ever had, and I would strongly encourage GPs to consider this technology for the better of their patients.